Once again, I'm glad that everyone could join us today to go over this software that I'm very excited about to share with you. Starting with the software, what is myQA? myQA is your global QA hub that connects all the different QA processes you have going on inside of your clinic. It connects you with IBA itself and connects you with other IBA users. So really, it's a global platform in the sense of you're globally communicating with all the different areas and people involved in cancer care. There's integrated data management through a single SQL database. There's applications for each section of QA that you need to perform. We connect you with the latest information happening at IBA with an RSS feed, so you're always up to date about all the latest shows we have coming up, maybe any IBA Academy on the Road trainings or any opportunities to receive CE credits. You're always trained through any classes we have offered at our ICC in Germany. We have a support portal that connects you with IBA staff in case you have any questions or queries. And we connect you with the IBA Care program so that you can basically interact and share your experience with IBA with other users and a whole lot more. So what's the 30,000-foot view look like of the myQA platform? Well, this software platform allows you to integrate all of your QA applications, get an instant QA overview, have an intuitive and unique interface, and simple and clear reporting. Now, the way we can do this is connecting everything through the IBA myQA platform. And the platform runs with an SQL database that's safe and secure on your own server. So we kind of look at the architectural view here, and we see all the different applications. We see IBA that you're connected to. We see a satellite hospital. If you have maybe several satellite hospitals, you can set up one single SQL database and manage all the database from there. You have complete visibility through the myQA cockpit. And you're able to basically then share your data through the secure myQA cloud, sharing machine QA data, anonymous machine QA data, to do comparisons between your results and then benchmark them versus all the other users out there. The myQA cockpit allows you to get instant command and control and overview of all the QA tasks happening in your center. If I want to go ahead and look at all my QA results for that day, I can go ahead and pull this up on my iPad or iPhone or Android tablet, and I can get an idea quickly of all the results, what those were, and look at data trending as well, without having to log into the software. The myQA Cloud is a very interesting concept that we created, and we're very excited to create something totally new, where you're able to share your myQA results with any other users out there anonymously. And what this does is basically help you benchmark yourself versus users with similar machines, similar sites, and are doing similar tests. This is purely machine QA data, and it's all anonymized, and this allows for storage and benchmarking of data. So this is one example right here. You can look at maybe an output trend and look and see statistically where your output of your machine would trend with other similar users. This is something that we're going to be releasing sometime this year, and it's a really interesting component because you're not storing your own data in a sense on the cloud. That's stored in the secure SQL database. But what you have with the cloud is the ability to share certain portions of your data that's not patient-related and use it. How does the software actually look when you're talking about hardware? Well, myQA patients, myQA machines, and myQA Accept are the three major software modules that we're going to discuss today briefly. And myQA machines is used for your planar dose patient verification. myQA machines for all dosimetry tests, quality assurance tests, custom tests, and especially for complete TG142 coverage. myQA Accept is our commissioning and annual software used for water phantoms. And basically you're able to then do all of your commissioning and acceptance tests. And then because you're in one single platform, compare your monthly QA with the original commissioning and acceptance data that you took. So myQA Patients. myQA Patients, as I said, is our new planar dose QA software. If you're familiar with the old IMRT software, you can see this software is a complete new look. We've basically integrated some new tools into this and optimize the workflow inside the software so that you can quickly import your data, do a comparison, do all the different tools you need to use to analyze the data, and then print out a report and send to your record and verify very quickly and very smoothly. You could do a quick gamma or DTA analysis with a couple buttons, and then you're able to look at profiles, isodose lines, histograms, and all the other tools you take into consideration statistically. Because everything's connected in a database, you're able to go ahead and import patient data, create a patient plan, create a patient project, and then once you've done that, you're able to go ahead and do the comparison, archive the patient, and then they're in your database forever. So if at any point you need to come back, get the patient, and maybe do a boost plan, you can re-pull up that patient because they're in the database. So you don't have to worry about saving any patient files anywhere or losing data inside of a large file structure. Everything's inside the database and secure. myQA Accept is the water phantom software, I said again, for the commissioning and acceptance. And the really great thing about this is you can then compare your acceptance and commissioning data with your other peers as well through the myQA cloud. And this is something that we're going to be releasing a little later this year inside the software as well. myQA Machines is the workhorse part of the software when you're talking about keeping track of all your QA tests. You can have full coverage of myQA TG142 coverage in here. There's a Dissymmetry plugin, MLS QA plugin, VMAT plugin, EPID QA plugin, Cone Beam CT plugin, and a FastTrack mode for beam steering and all the other quick measurements you need to do inside your software. myQA Machines. So breaking down what's actually inside of this large module myQA Machines, we see we have a set of dissymmetry tests. And what you're able to do here is use one of our Star Trek devices or Matrix family devices and take direct measurements for TG142 or any other tests you need to do with your LINAC. So you can look at the typical daily and weekly, monthly tests that you need to trend flatness, symmetry, energy output, and any other test. And once you have that, you can benchmark and compare your data here as well. myQA Machines also has a full set of templates. TG142 is a standard template we offer with the entire protocol, and you're able to then look at the different tests you need to perform. If you don't have one of our IBA devices, not a problem. You can use your existing device. Maybe you have a PTW or Sun Nuclear device or standard imaging device. You take your measurements and then input the data in here, and you can track and trend that same data inside of our system. You have the ability to also export and import any custom protocols you create. So if I have a daily QA test that I do in my clinic and maybe someone else isn't doing it, it's a little different than what's done in TG142 or it's an extra test, I can easily create that custom protocol and send it to any of my fellow physicists and export it if I need to do that. You can keep track of all the QA workflow that you have going on in your clinic. And James is going to talk a little more about how he's actually customized his own templates and is using them inside of his clinic. And then really the nice thing about this is in an age where compliance is so important, quick and easy QA reporting exists inside the test repository, allowing you to quickly select a group of tests and create a report that you can produce. We have MLS QA, which uses EPID or film, and it gives you an automatic analysis of picket fence test. You can calculate errors, leaf positioning accuracy, and get full automatic processing inside of here. We have a dynamic MLS QA module for a lot of our varying users or elector users out there. And you really can save a lot of time using this module by taking an EPID image and then comparing your open versus modulated fields, dose rates and gantry speeds, and the things you have to look at when you're doing VMAT machine QA. For KV and MV imaging or EPID imaging, we have an automatic image analysis that's done. We have the IBA Primus Phantom, or for some of our older users out there, the Digis 13 that we provide. But we also support all the other phantoms that are provided by the major LINAC OEMs or the other vendors out there. So if you have, like I said before, maybe one of our competitors' phantoms, not a problem. We support that, and you get automatic analysis of that phantom inside of here. If you have a custom phantom, not a problem. We can set up a custom phantom, import it, and then you can select your regions of interest, and then use that for your monthly QA as well. For Cone Beam CT, we have the Cone Beam CT imaging QA, and we support most of the existing image phantoms out there, the CAT-FAN series and a lot more. So if you have that, not a problem. We'll cover that, and we have your own creative imaging phantoms which you can QA as well. Now, we talked briefly about the software, but what about hardware? IBA has a lot of hardware right now, and the two hardware devices that can provide great ability to do all of your machine QA that's done inside of the Dosimetry Tests or part of TG142 would be the FastTrack and the Matrix. Today I'd like to talk briefly about the FastTrack, and especially because James is a user of the FastTrack as well. So what if you could quickly verify your LINAC without a water phantom, instead of having to spend time and set up a huge water phantom, a 3D or 2D phantom inside your table? What if you could save time during QA measurements and get the whole profile immediately? What if you could have a simple and affordable solution dedicated specifically to LINAC QA and measurements and not have to worry about using your patient QA device? Well, the FastTrack provides efficient reliability in machine QA and can answer every one of those questions and concerns you might have. A FastTrack is a 453 ion chamber array with 5 millimeter cross-line and inline resolution and 7 millimeter diagonal detector resolution as well. It provides coverage of up to 27 by 27 with the chamber array, and you get up to a measuring field of 25 by 25. So pretty much enough for your flatness and steering, flatness and symmetry or beam steering and things like that. We have additional chambers which you can see in these different spots used for energy verification, and direct connection to myQA for all tests. So you would go ahead and take the measurement with your matrix, and it automatically populates, or the FastTrack, and it automatically populates those results inside your database. For quick energy verification, we provide 2 energy verification build-up plates. Within simple exposures, you can get your energy verification and then save that in the database as well. How else can I use my FastTrack? Well, the FastTrack will fulfill most of the requirements that you need to do for machine QA. And through our FastTrack module, you're able to get live beam information and look at the X and Y or diagonal axes. And you can use this for LINAC tests for any kind of OEMs out there. If you're using the FastTrack inside of your factory, it's great to put on the table and look at flatness and symmetry and do different factory tests you might have with your LINAC. For field installations and field services, if you're a commissioning group and you need to throw a device quickly on the table and do quick measurements, it's perfect, it's easy, it's compact, you can put it in the back of a car, it has a nice little case, and there's a lot more tests which you can do. One nice little example of this would be looking at the FastTrack module that's inside of our myQA. And what the FastTrack module is it connects to the FastTrack or matrix and gives you instant profile analysis and look at dose, at CACs, field width, penumbra, flatness, symmetry. You can select a number of protocols, and then you can compare different measurements. Export measurements. You can look at the startup of the machine and do energy verifications on the fly as well. When we're talking about beam steering, maybe you had some work done to take some LINAC errors that were happening inside of your clinic, and you need to actually then verify the beam steering after the variant engineer has made his changes. What you can go ahead and do is hook up your FastTrack, look at the FastTrack, and look at live beam steering. So you can get real-time information about what adjustments need to be made to the flatness or symmetry after things have been changed.